Hey, what's up? It's your boy, Dion Lewis. What if I told you the future of mental health isn't just one on one therapy, but powerful, peer led communities? What if providers could scale impact without burnout? Now, today's guest is flipping the script on how we think about healing. Tamar Blue is the founder of Mental Happy. It's a platform helping therapists, life coaches, and everyday change makers run support groups that actually work. No bots, no chaos, just real people having real conversations and getting real support. Now, Tamar's background blends tech, wellness, and a deep understanding of what people actually need when life gets messy. From starting a Facebook to building a HIPAA compliant platform used by over 1,500 providers. Her journey is a blueprint for purpose driven innovation. Now, in this episode, we get into why group support is rising fast, how Mental Happy makes providers' lives easier, and why healing doesn't always mean hiring a therapist. Now, if you're a provider, entrepreneur, or someone who just cares about mental wellness, stay locked in. This episode is definitely for you. Now let's get into it. 3, 2, 1, go! You're listening to the Healthy Project podcast. I'm your host, Dion Lewis. Today, I have a great guest with me in the building, founder, I don't want to say co-founder, founder of Mental Happy. So I'm excited to get into, the kind of the genesis of what you're doing and really talking more about how you're helping people. So, Tamar Blue, thank you so much for being here. I appreciate it.
Thank you so much, Corey, for having me. And thank you so much to all the listeners. Thank you for listening.
Yeah. So, before we get into it, can you tell the people a little bit more about yourself and, what gets you up in the morning?
Okay. My name is Tamar Blue, founder of Mental Happy. And I'm originally from Florida, if that matters to anyone. And what gets me up in the morning? Probably right now, my toddler. but other than that, I'm always I'm just very excited. We get numbers every morning, like how many people have joined and the metrics, and growth has been great lately. So lately, that's been pretty nice to wake up to numbers.
Yeah, it's always good to wake up to good numbers. I can't be mad at that. And kind of getting there. I love to get right into Mental Happy and, kind of the beginning. What gap did you see in mental health support that made you want to build your own platform?
Yeah. So, we started off with a physical wellness product in the beginning. And while it was very touching for people to receive this beautiful wellness kit that gave them tools and resources and information for them to feel better, motivate them, uplift them, one of the feedbacks we were constantly receiving is like, oh, well, is there like a group I can join? Because, I still need some help navigating whatever life thing that I'm experiencing. And we noticed, like, once we looked around in the market, it's really mirrored what was happening in healthcare, right? Like, people go to see a doctor, maybe they go to the emergency room, and then they walk out of there and it's like, but then what? You have a prescription that you're supposed to take, but in any healing journey, in any healthcare journey, there's a lot of nuances that you now have to navigate mentally. And then just the mental strain of whatever it is that you're experiencing. Imagine getting a diagnosis of something that you had never heard before. And now this is your new normal, and you're the only one that that is experiencing this life thing. So just the experience that we had with the product in its infancy stage to what we ultimately wanted to be, we noticed that there was this gap between, initial care and everything post after that.
Yeah. What's interesting about that is I feel like just naturally we as people are constantly looking to be in community, no matter, like, okay, this is great, but what's next after this? Like, and looking for that support and looking for that help. What makes group-based support so effective for mental and emotional health?
Yeah, there are a lot of really great studies that are now showing that support groups and emotional support, or my favorite term for it that seems like it's really catching on, is community-based care. I really love that. A lot of the studies are showing that it amounts for as much as 30% of health outcomes for people, on whether they live or die, how fast their healing journey could be, how supported they feel throughout the process. It's one thing to experience something, like maybe you do have an illness or you were diagnosed with something, but it's a totally different thing to now be navigating the emotional and mental deterioration of that physical life event, right? So if people have that emotional support, studies show that they're less likely to have some type of mental deterioration on top of that.
That's dope. And when I think about my own mental health journey, or things like that, when we're talking about mental health, it is very personal. Like, stay out my business type of a thing. But people are turning to group support instead of like your traditional one-on-one therapy. Why do you think that is?
Well, and I hear you. I echo what you're saying in terms of a lot of people feel like, well, when I'm going through something, I don't want anybody to know, because for fear of shame, for fear of embarrassment. And, oftentimes when you're going through something, you kind of don't really, and if it's new, you don't really have the language to even explain it to someone else. So I get that. And then what we also see is that there are, cultural communities where people feel like, hey, what happens in our house stays in our house. Like, don't share it out to anyone else, So a lot of people grow up with that. But I think the difference is that the moment it truly is happening to you, and it's been happening to you for a while, it's kind of like, yeah, it's a pretty lonely place here. So I think that's what makes people like go out and find group support, because you may have had those beliefs in theory, but in practice, when it all hits the fan, it's kind of like, yeah, I need this support. I think studies are showing that people are also looking for support in greater numbers now more than ever, because we historically live further away than any generation before us from our parents and where we grew up. It's more common now that people live hundreds of miles, thousands of miles on a different coast than where they grew up before. People go to church less than historically ever before. So normally you would find community support groups in churches are a big thing. But if you don't go to church,
right,
you're not going to get support, right? Like, a lot of churches have recovery groups, they have grief groups, but if you don't go, you don't know. So, and another reason is that people are by far getting married less even, right? So that takes away a lot of community, because if you're not a couple, maybe you have your family or you don't have your family, but you would have also had your partner's family for support, right? So people are looking for virtual spaces online by and large, just because of like these societal shifts in how we're living. I think on the other side of that, that's the group participant side. On the group facilitator side, there's just sheer numbers, right? Just far less people able to give support than the amount of people needing support. The last statistic was like 100,000 licensed therapists for every 31 licensed therapists for every 100,000 people in the United States. And that's on a deep, deep decline, because people are leaving the profession. These professionals are experiencing burnout. So professionals are looking for a way to create support group spaces, because it allows them to leverage their business, scale it better, see more people in an environment, offer more education in a group setting. And what we really love is that we see people who are advocates, whether they're licensed or unlicensed, survivors, also leveraging like these virtual support group spaces where people may live very far away from each other. They may live in rural areas and can't, get to an in-person type thing, and leveraging these support groups for that.
No, I love that you brought that up because my next question really is more geared towards, understanding the mental happy platform. And yes, it supports those that are looking for support groups and things of that nature. But the platform is for your providers, your therapists, your coaches and peer specialists. Can you talk a little bit about how mental happy supports those individuals in those professions?
Yeah, so we originally started the support group platform for us because we initially realized this gap, and it's like, oh, people were asking us for these like groups and community, and we were running it on another social media platform. It just became unmanageable with advertisements and bots, and we didn't know who was a human, who wasn't, who was a troll, who wasn't. So we built the platform for ourselves, and then had the aha of like, oh, if we're experiencing this, then other people who are building groups online or even in person are having the same issues. So for initially, it's because we were also the ones that need it. It's for providers. It's really for the people offering support, and it allows them to safely onboard individuals that want to join a support group. Sometimes people have to do a lot of things when they're running a group. They have to advertise it on Eventbrite, and the group is
Right.
hosted on like Meetup or Facebook, and they have to send people Zells and PayPals to collect money. And the scheduling is really hard to kind of keep. You have to send out a Zoom link. So you have to use Zoom to create like a schedule. And it's just like all of these different components where on our platform, it's one true safe space where you can onboard, collect payment, share resources. Your members can chat with one another. And we keep the platform HIPAA compliant and safe for both of those parties to be able to be in the group. Group facilitators can do what they do, and group participants can find the help that they need and know that it's a vetted group and not just some, who knows if the person's educated in that space or not.
Right, right. And I think what's so important about that is, one, you're right. There are so many different tools to make sure one thing happens well, but just having something in one place, it allows you to be able to focus on the work. Like it allows you to be able to focus on your group, supporting them instead of you burning yourself out because you got to send the Zoom, then you got to make sure you get paid this way. Now you got to do this, that, and the third. And it takes out so much work to where you can now focus on what's important.
Right. Absolutely. Yeah. And it makes it more scalable. Now, if you were kind of struggling and you can only manage running one group because you have all these different apps that you're on,
Right.
now you can actually scale and open. Like we onboarded an organization, and like in a day, they had moved all their 8 groups onto our platform, like something like 200 people across those 8 groups. So it makes it, and they also run a one-on-one practice on top of that. So if you're doing a solo, like a practice, and then you're also running supplemental groups, it just makes the work much more manageable for you and clients and patients and even members.
Right. So you just brought up another platform, Zelle. What trends are you seeing around providers moving to cash-based models or leaving traditional systems altogether?
Yeah, that's a scary one that's happening. A lot of providers and well, I think what people, yes, they are, a lot are leaving. Some are staying, but a lot are leaving. I think what people are not seeing is that they think that billing the insurance, and the insurance shows this like very high top line number, like, oh, $1,200. Well, sometimes they
Mm-hmm.
get like $80, $130, $12 if it's
Right.
like Medicaid or Medicare. It's very little. Like, even though the top line shows of what they could get is high, what they actually get is very low. And also, because people are very on the health consumer side, they're also very leery of like charging their insurance too much. So if you are going to therapy like on a regular basis, and maybe you're on a family plan, so your deductible gets used up a lot quicker, because again, that top line is very big, even though like the bottom line that they get is very little. So we're seeing it on both sides, where providers themselves are looking to go to like a cash-based model, and health consumers just want the transparency of the bill, right? Like, if
Right.
it's $100, it's $100. If it's $250 for a session, or you get 3 support group sessions, whatever it is, that that's it, and you're not going to get this surprise debt in the mail. So I think that's the reason for the decline on both sides. I think it's sometimes even better, because now people who maybe historically don't have insurance, maybe they're underrepresented, maybe they're undocumented, so there's just no way for them that now they can at least have access to some type of care, even if they're, paying something out of pocket. So it is a growing trend, this kind of cash-based model. A lot of we've also seen providers do like even like physicians, doctors. Like, once upon a time, it was like a private care doctor that you paid them like this monthly retainer. Now it's just even regular people. Like, I met this full doctor. She graduated from Stanford. She has like an out-of-pocket model where you can call her an X amount of times a month, text her an X amount of times a month, get X amount of physicals a year for like $500 a month. That sounds like a lot to most people, but $500 for a private doctor, that's like unheard of, right?
Right.
So, and if providers are able to do that with like a good book of business, with a good number of patients, it creates a nice, 6-figure income for them, without like the overhead, without the stress of this and that. They still have to carry insurance, but I can see reasons why the cash model works on both sides. I can see reasons why, just especially on the health consumer side, why the cash model could maybe suck. Because if someone is a wonderful doctor and they are an expert in that one rare field that you have, but they only accept cash, and you don't have the cash, you have insurance. So I can see both sides.
Right. And I agree with what you said too, Tamar, about it. There is an aspect of that where it is giving people access that don't necessarily have access, because they may be thinking they have to go through their insurance or whatever. But if that provider can be creative with what their offering is, that can actually help them more than having to go through the system. You know what I mean? So I kind of see that actually, depending on the creativity of the provider, that could be a great thing.
Yeah, and I've seen some really interesting plans. I got a letter from a physical therapist for my child, that when we were seeing that physical therapist, they were on the insurance model, and they literally said that they were only receiving like per session $30 from the insurance. So they're moving forward. Any other physical therapy sessions will be on a cash basis, and they have subscription models. They have one-time pay. You can buy packages. They also have to survive and support their head of their business, and they're getting a lot of and this is mostly like really small providers that are feeling squeezed by the insurance companies. At least this is what I'm reading online.
Right. Yeah, I believe you. Tamar, you said something when we were actually having kind of, this conversation before we even had this one. You said something that I was really interested about, and it's not everybody needs a therapist. Right. And I agree with you. I agree not everybody needs a therapist. But what do people need more of? Like, those people who don't need a therapist, kind of break that down for me. And what do you think people do need?
Well, I will preface this by saying that we definitely, society as a whole, needs therapists.
Yes.
We do need therapists. I mean, there are people with really deep, primary and secondary, issues that really,
100%.
psychosis. Like they need some type of person to kind of work them through that mental process. And different psychotherapies, right? But what's interesting in social media nowadays is just like everyone is like a victim of childhood trauma, and everyone is dealing with a narcissist, and everyone has toxic parents.
Right.
And it's like I think social media has given people the language, which is good because once upon a time we didn't have the language, but it's just not
True.
everything that you're going through is a traumatic life experience. A lot of things these are the normal cycles and hardships of life. And those hardships, form you, and they give you new information. They give you a new level of resilience. I think we've kind of, as a society, have become, kind of avoidant of like wanting to deal with things and just labeling it and saying like, oh, I'm OCD, or I'm without actually going to a therapist or just talking to your therapist about boyfriend issues or, something like that. It's just, it really, this is also why there's such a backlog of people who really do need the help and really can't get in because now everyone feels like they need to just talk to a therapist. So what I will say is that I think, again, going back to the statistics of how we live further away from our parents, we live further away from family, we live, we're not finding community in traditional places where we once find them before. So if you are going through something as like you broke up with your boyfriend, normally 100 years ago, you could probably go to your parents, you probably go to church, you could talk to your neighbor, talk to a friend that's nearby. And I think
you'll be in community with somebody.
You would be in community and you would be able to resolve those issues in community versus, paying a couple $100 to talk through some things. So I think what we do need is this sense of like, yeah, heartbreak sucks, and if it's habitual and it's a pattern of dating a particular type of person, going through a particular type of heartbreak, yeah, you do need to work on that. And there's a platform where there's like education and other people going through the same thing and, people who can empathize and sympathize with you, but it may not necessarily be, you need, hardcore therapy for it. So
yeah,
I'm on the side of the therapist of saying like, maybe a lot of people are, taking up your time where there are more serious patients that you could be dealing with.
Yeah. Or a therapist can tell you, no, you're not dealing with the narcissist, this, that, the third, because I love social media as everything. It's a gift and a curse because you'll have those people that will get that social media post or that reel and be like, oh, that is me. Or I know that person. I am dealing with that. No, you're not. And they'll take it and go with it.
Right.
But they're able to.
He's just a jerk or she's just a jerk. They're not a narcissist. They're just, making bad
decisions. Yeah. And again, that could be a situation where you're either, you can see a therapist and they say they can actually let you, if you're a good therapist, can say,
yeah,
oh, X, Y, Z, but also having a space and a platform. I'm assuming you like Mental Happy, where you have those vetted resources that you can get those answers and you can trust those answers instead of trusting TikTok, all the time. And I know great people on TikTok that are doing great work in the mental health space, but not everybody is them.
Yeah. And a lot of it is just, the education, right? So that you can make more informed decisions moving forward versus just, talking someone's ear off for 50 minutes and then a week and then you just keep doing the same. Nothing is learned. You just kind of keep doing the same thing over and over. So yeah, I'm kind of a believer that it's great. I've done it for certain periods of my life, but it's not something that I need forever.
Right. One term, and this was my next question, you kind of brought up some of it a little bit. This term that is being talked about, which I think is great, is community healing. Talking a lot about how do we heal as a community. And you kind of brought up you brought up education. How can education, advice, and community serve as tools for healing?
Yeah. So my favorite example of like this community healing, community-based care is so we had so I interview users all the time, like customers on both sides. I just want to kind of get some understanding as to what they're doing on the platform, if they're willing to talk to me. And I was talking to a group participant who joined a group, and I asked her, like, hey, how'd you find us? What brings you here? You know, her mother was experiencing, was healing from like a brain cancer. And her mother had been going through that for a while. And she said that, the care that my mother is receiving is like top notch with the doctors. And, they've been really good with medication and stuff like that. But when I was in the group, I learned a lot of things that you just don't have the time to ask in a doctor's appointment, and you don't even know to ask in a doctor's appointment. So people in the group were advising her on, her mother had issues eating early on, helpful smoothie drinks that, help her get down the medication and also are a filling and nutritious meal. And she said she learned a lot about how to better organize the house and the bathroom so that her mother doesn't have like an accident, because, if you had brain surgery, you're prone to stroke, you're prone to falling. So like how to organize the house so that if she does fall, she has grips and stuff. She was like, these are all like little things that you don't get in a doctor's appointment. You get this is what's wrong with you. This is how we're going to help you make it better. These are the medications. This is the protocol. You don't get the how do you now live your life in this new normal? And how do I, as a caregiver, an informal caregiver, support my mother in this new normal? And she said that's what she got from the support group. So to answer your question, I think community-based care is important because there are so many lived education and information and lived experiences that even with the top-notch professionals, they may know, it's
right.
not what they're doing. They have like 20 minutes, they got to see other patients. Shout out to nurses, because nurses tend to kind of give you like these little tidbits of advice and help and stuff like that. But again, it's just there's a place where you can probably get that type of advice all the time.
No, that's real. No, I appreciate that. Tamar, what is your vision for making mental wellness more accessible?
My vision for making a platform like Mental Happy more accessible is or at least I'll say when Mental Happy is just a staple across like hospitals. So hospitals have support groups. Some of them are run by volunteers.
Right.
You have to call, send an email. And it's not really like a standard thing. And sometimes they have the group, sometimes they don't. I would love to see Mental Happy be just kind of like the standard, just like you have like a My Chart and
right.
all the hospitals run on My Chart. Like I'd love to see like all the hospitals have some type of support group for all the chronic things on the Mental Happy platform. And that's their form of care. It's like step one, this is your primary acute care. And then you move on to emotional care from there, should you want to. And that could be, some of that maybe cash out of pocket. Maybe that's covered by insurance. A lot of the hospitals offer support groups for free, and maybe the hospital covers it. But it would be great if that was a holistic part of our care and system.
Right. Right. And I love that, we talk a lot about patient-centered care. And I love that having now, as we have more technology and tools available to us, that patient-centered care has to look different. We got to have these other tools around to support patients. So I love that vision. That's a great vision to have. I love that.
Yeah. Thank you.
How can providers or organizations get started with Mental Happy? What is that process like?
It's pretty easy. You just go to mentalhappy.com and you can either book a call to learn a little bit more. Maybe your organization's a little bit bigger. Maybe you have many groups that you're trying to kind of get onto one platform. But if not, if it's just a group and you want to try it out, and just click the Get Started button. And it takes maybe 5 to 10 minutes to set up your group. You can add all your content that you want on there. We always offer a complimentary call where we walk people through on how it works for the group facilitators, but also how it works for your clients or patients.
Okay.
And what's really great is that your group participants get access to mobile apps, so either iOS or Android, so that they can have access to the group no matter where they are. And you can host groups in person, virtually, but everything could be done through the app.
Perfect. Well, Tamar, you started this company because you saw, a problem in the space. What's one message that you want to leave listeners with who may be struggling?
Yeah, first I would say you're definitely never alone, no matter how alone you feel in the moment. And if you feel like you could use a little bit more support, help, people who maybe are like-minded, you're looking for that education, consider joining any support group that you may find in your area, but definitely consider joining Mental Happy to see if you can find a group for you online.
Perfect. Well, Tamar, thank you so much for being on the podcast today. For those that are listening, that want to learn more about you, learn more about Mental Happy, where can they find you?
We are at mentalhappy.com, and we're also on LinkedIn, Instagram, Twitter, Facebook. We're everywhere online, but definitely our home is mentalhappy.com. That's the easiest way to get a hold of us. At the bottom, we have some really great links. If you are looking to partner with us, you can put in a request. If you are just interested in like free mental health wellness tools and resources for either yourself or maybe your clients or your patients, or just type of different engagement tools, we put a lot of love and care into our free downloadables. They're quite popular whenever we release some online. People love them because they offer really tactical steps and advice. So definitely check out the mental health resources at the bottom of the page. It's always free. And you can message us if you have any questions.
Awesome. And I will also make sure I add all of those links in the description of this episode to make it easy for y'all that didn't listen to this part. Again, Tamar, thank you so much for being on the podcast with me today. And everybody, thank you for listening to the Healthy Project podcast. I'll holler at you next time.